Hi everyone, my name is Mellon Gasingana, a volunteer of Rwanda Lady Cross at the Kitchen branch. The COVID-19 program that I focused on was like reducing the workload of doctors, because we know due to COVID a lot of patients have increased because of COVID sickness. So doctors no longer have work to do after, like before, medical services, which are like checking if you paid insurance and also some appointments with doctor. So I just focused on checking before medical treatment services, which are checking if you paid insurance. That's why I just wanted to use opportunity that we already have, but that is not. That's why I just sort of using some opportunities that we have, but it's not specifically used in hospitals or health centers. So I just wanted to use Ilembo program that is used by the government, where you can find any government document. In that Ilembo, you can also check if someone has paid insurance before treating that person, rather than taking papers to the doctor to check or to the nurse to check if you paid insurance. That I'll be using that by having one representative at each health center that will help patients to check if they paid insurance without taking papers and their IDs. It's just saying your number of ID and you just be checked if you paid insurance. Thank you. This is Ilembo service I was talking about. We have a lot of services here, as you can see. You just enter ID number here. After entering ID number, you enter amount here. Prepaid insurance. Thank you. Thank you. The process I used to test my prototype or to design my prototype was like I went to some health centers where I just tested there, asking people to just mention their ID numbers and help them to see if they paid insurance. I also tested with some friends and family members by just entering their ID number and check for them if they paid insurance. Thank you. And also, thank you. My learnings about testing my prototype was, though we had this Ilembo service in government, but it was not specifically used in health centers, as I said before. So I learned that it was really needed there because doctors had a lot of work. We had to have our representative at each health center so that we can just reduce the overloaded work of doctors. So that was my learnings. I learned that this was a gap of this Ilembo to just feed it in health centers. Thank you so much.